In this presentation, we will be seeing about the ovarian cycle. Now, ovarian cycle can be asked as a 4-mark write briefly question. So please write about the menstrual cycle first. Menstrual cycle is the cyclical changes that occurs in the reproductive system of a female. These are periodic preparations for fertilization and pregnancy. It consists of the ovarian cycle, endometrial or the uterine cycle, cervical changes, changes in the vagina, changes in the breast, and also the hormonal changes during the menstrual cycle. In this presentation, we will be seeing in detail about the ovarian cycle. Then write about the phases of menstrual cycle. So a normal cycle is taken as 28-day cycle and ovulation occurs on the 14th day. So in the ovarian cycle, there is a follicular phase or the pre-ovulatory phase and a luteal phase or the post-ovulatory phase. In the endometrial cycle, the first 5 days, it is the menstrual phase, followed by the proliferative phase, and after ovulation, it is the secretory phase. Now we'll be seeing about the ovarian cycle. Now about the follicular phase. In the follicular phase, about 10 to 12 primordial follicles, which are always present in the ovaries, enter into the cycle and undergo the various stages. Primordial follicles develop into the primary follicles, then further develops into the secondary or the antral follicle, and then ultimately only one of these will develop into a mature Graafian follicle. Now let us see each follicular stage in detail. So a primordial follicle, there is a primary oocyte surrounded by a layer of flattened epithelial cells. In a primary follicle, there is a stratified layer of granulosa cells around the oocyte, and there is a well-defined zona pellucida layer also. And in the secondary follicle, the oocyte is eccentric or off-center, and the theca externa and the theca interna layers develop, and the fluid accumulation between the intercellular spaces of the granulosa cells, they ultimately form the antrum, and this is called as the antral follicle. Then it becomes a Graafian follicle. In the Graafian follicle, it has the eccentrically placed oocyte, and it is surrounded by the cumulus oophora cells of the granulosa layer of cells, and this is within the fluid-filled antrum. Now this is a mature Graafian follicle. Next is ovulation. So ovulation in a normal 28-day cycle occurs on the 14th day. So just before ovulation, there is LH surge. When there is an LH surge, ultimately there is degeneration of the stigma. Stigma is just the avascular layer, and then there is swelling of the follicle. And for the degeneration of stigma, actually there's a lot of proteolytic enzymes like collagenase that is secreted, which weakens the follicular wall, and then there is degeneration of the stigma. Also, this LH surge will cause increased progesterone release, and then there is release of the prostaglandins, and also there is proliferation of the follicular vessels. So there is increased plasma transudation into the follicles, and there is swelling of the follicle. And these morphological changes will cause the rupture of the follicle and release of the ovum. This is called as ovulation. Then you can also write that LH surge is an example of positive feedback mechanism, and also about the tests of ovulation. Following ovulation, there is the luteal phase or the post-ovulatory phase. So after ovulation, that area in the ovary becomes corpus hemorrhagicum, and then this further develops into corpus luteum. If there is no fertilization, the corpus luteum regresses to form corpus albicans. Now just briefly about each stage. After ovulation, the outer wall of the graphene follicle collapses and fills with blood. This forms the corpus hemorrhagicum, and the granulosa cells and theca cells, they begin to proliferate, and the clotted blood is replaced by yellowish lipid-rich luteal cells referred to as luteinization. And this is the effect of the luteinizing hormone, this LH hormone. Now, if there is no fertilization, the corpus luteum begins to regress and it is replaced by a whitish scar tissue, and this is due to the falling levels of FSH and LH and also inhibin, which are secreted by the lutein cells. Now about the significance of the corpus luteum of pregnancy. If there is fertilization and occurrence of pregnancy, then the corpus luteum that is formed is, it persists and it secretes large amounts of estrogen progesterone until the 3rd month of gestation. After this, the placenta takes over its endocrine function. Now in the answer, you can represent the ovarian cycle in a single diagram. So first 5 days menstruation occurs, then the follicular phase followed by ovulation, and then the post-ovulatory phase or the luteal phase. You can draw the primordial follicle developing into the primary follicle, developing into secondary follicle, then the graphene follicle, then ovulation occurs on the 14th day. Then in that area, corpus hemorrhagicum is formed, and then this develops into the corpus luteum. If there is no fertilization, this regresses and forms the corpus albicans. In the same diagram, you can show the various hormonal changes, that is the changes in the FSH, LH and estrogen and progesterone. So this will be covered in detail in another presentation. Then you can write about the clinical aspects. First one is anovulation. Physiologically, it is seen 1 to 2 years after menarche and few months before menopause. Also, hormonal deficiencies may cause anovulatory cycles. Next one is luteal insufficiency. If there is a luteal phase defect, there is inadequate secretion of progesterone leading to early termination of pregnancy. So that's about it. Thank you.